Glenn Whitley, County Judge.
Here.
Roy C. Brooks, Commissioner Precinct 1.
Present.
Andy H. Wynn, Commissioner Precinct 2.
Here.
Gary Fickus, Commissioner Precinct 3.
Here.
J.D. Johnson, Commissioner Precinct 4.
Here.
Constitutes a quorum.
Thank you. Our invocation this morning will be delivered by Pastor Brent Beasley from Broadway Baptist Church. Thank you for being here today. After the invocation, please remain standing for our pledges.
All right, let's pray together. Eternal God, fount of all the wisdom that we seek, we ask you to bless the representatives that we've elected. Grant that through their discussions and decisions, we may solve our problems and achieve together a more unified society and enhance the well-being of this place where we live and serve and raise our families. And we pray for the people of Tarrant County, those working and without work, homeless and well-housed, fulfilled or frustrated, confused, and cluttered with material goods or scraping together a life from others' leavings, lonely or living in community, having revenue problems or spending problems. We pray for our sisters and brothers, mourning, celebrating, living. May we share both their suffering and their hope and be worthy servants of all. Amen.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Honor the Texas flag. I pledge allegiance to thee, Texas, one state, under God, one and indivisible. Thank you, Reverend.
Mr. Manius.
Thank you, Your Honor. Members of the Court, we have one item as it relates to the agenda this morning, and that's under the Administrator's section item 9A3. We're going to ask that we hold that at this time. Thank you, Your Honor.
Court members, you have before you the minutes of our regular meeting of April the 10th.
Move approval. Second.
We have a motion and a second. Any discussion? Please vote. Motion passes unanimously. We have several proclamations and today, proclamations and resolutions. Commissioner Brooks, I believe you have the first one.
I've got the first two, actually, and with your permission, I'll start reading into the record.
Go right ahead.
The first one is for the African American Health Expo 2012. Whereas African American Health Expo endeavors to reach more than 2,000 participants to improve access to health services and to decrease health disparities in the African American community, and whereas the AAHE provides free HIV testing and linkage to care because new HIV infections among Carron County African Americans are 7 times the rate of whites, and 40% of all new cases are among young people of all races under 25 years of age. And whereas the African American Health Expo reflects coordinated efforts with other agencies to educate the community on the many illnesses and diseases which negatively impact the African American population to address the growing incidence of chronic disease. And whereas, because 7 out of 10 African Americans aged 18 to 64 are obese or overweight, the African American Health Expo promotes physical activity, healthy eating, and provides nutritional and bariatric education. And whereas the African American Health Expo, in partnership with John Peter Smith Health Network, provides prostate screening and education because African Americans are more likely to die from cancer than any other racial or ethnic group, where the men are 33% more likely to have prostate cancer than any other ethnic group. And whereas improving the overall health and wellness for African Americans not only closes the health gap for people of color, but it also improves the health of the entire Tarrant County community. Now, therefore, be it resolved that we, the Commissioners' Court of Tarrant County, do hereby proclaim April 2012 as African American Health Month and call upon all citizens to join with the Tarrant County Public Health Department and the members of the Planning Committee in celebration and support of promoting healthy living for people of color. In witness whereof, we have hereunto set our hands and caused the seal of Tarrant County to be affixed this 7th day of April, 2012, and I move approval.
Second.
We have a motion and a second. Please vote. Motion passes unanimously.
We have here this morning to receive this proclamation Dawn Dickerson Sankofa, Health Equity Coordinator for Tarrant County Public Health Department and the Chair of the Planning Committee for the African American Health Expo. Dawn, would you please meet me at the podium?
On behalf of the African American Health Expo Planning Committee and Tarrant County Public Health, I'd like to say thank you for this acknowledgement and also thank you for your continued support. I've been in Tarrant County now going on 4 years, but this has been a health fair that's been going on now for 10 years, and every year we've gotten support from Commissioner Brooks. Thank you very much.
Thank you.
Thank you.
Next,
Yes, there you go.
we have a proclamation in honor of National Crime Victims' Rights Week. Oh, this is little. This is about an 8-point font. At any rate, whereas 18.7 million Americans are directly harmed by crime each year, and each crime affects many more family members, friends, neighbors, and co-workers. And whereas the physical, emotional, and financial impact of crime falls on people of all ages and abilities, and of all economic, racial, and social backgrounds. And whereas, in addition to these challenges, crime victims face a criminal justice system that, at times, ignores their rights and treats them with disrespect. And whereas, in 1982, the President's Task Force on Victims of Crime envisioned a national commitment to a more equitable and supportive response to victims. And whereas the nation heeded this call to action and promoted victims' rights initiatives, effective and compassionate victim services, as well as just compensation and financial support. And whereas today, thousands of victim assistance programs provide help and support to child victims of violence and sexual abuse, stalking victims, survivors of homicide victims, victims of drunk driving crashes, victims of domestic, dating, and sexual violence, as well as other crimes. And whereas now is the time to extend the vision through a comprehensive strategy of reaching and serving every victim of crime, especially traditionally underserved victims, such as those with disabilities and victims from diverse cultures. And whereas the United States Department of Justice has launched the Vision 21 initiative to renew our nation's commitment to serving all victims of crime in the 21st century. And whereas National Crime Victims' Rights Week, April the 22nd through the 28th, 2012, provides an opportunity to extend that vision to every victim of crime in the United States to help ensure their access to the help they deserve and the rights they are promised. And whereas the Tarrant County Coalition of Crime Victim Services, the Tarrant County Council on Family Violence, and the Tarrant County Sexual Abuse Advisory Council are joining forces with victim service programs, criminal justice officials, and concerned citizens throughout Tarrant County and America to raise awareness of victims' rights and observe National Crime Victims' Rights Week. Now, therefore, be it resolved that we, the Commissioners' Court of Tarrant County, do hereby proclaim the week of April the 22nd through April 28th, 2012, as Crime Victims' Rights Week throughout Tarrant County, and reaffirm this county's commitment to respect and enforce victims' rights and address their needs during Crime Victims' Rights Week and throughout the year. Be it further resolved, we express our appreciation for those victims and crime survivors who have turned personal tragedy into a motivating force to improve our response to victims of crime and build a more just community. In witness whereof, we have hereunder set our hands and caused the seal of Tarrant County to be affixed this 17th day of April 2012, and I move approval.
Second. We have a motion and a second. Please vote. Motion passes unanimously.
With us this morning to accept this proclamation are Lori Clarida, Victim Assistance Coordinator with the Sheriff's Department, Kelly Willis, Tarrant County Council on Family Violence, and Sean Brown, Tarrant County Sexual Abuse Advisory Council. Would y'all please join me at the podium?
You're on your own, Bubba.
On that one? It's not time to laugh yet. Huh?
JD's having too much.
No, I don't. Lynn's reading, man.
Welcome.
Welcome.
Morning.
Thank you, Judge. Thank you, Commissioners. Thank you, Commissioner Brooks. National Crime Victims' Rights Week is typically the last week of April, which it is this year. I wanted to highlight just a couple of things. We have formed kind of a coalition in the county. There's a number of service providers that work with victims and survivors of crime. This year we have, and I have a representative from each, we have Sandy Branch, who is with the Tarrant County Coalition of Crime Victim Services, Sean Braun, who is with the Tarrant County Sexual Abuse Advisory Commission, and I'm representing the Tarrant County Council on Family Violence. The three councils, coalitions, combined because of the importance of working with victims and to highlight the work that's done in this community. There's many events planned for this week, and Ms. Francis will give you a schedule of those events so you're aware of them. Just to give you a quick idea, we did get a billboard. It's located on I-20. If you're that way heading west, look up and you may see it. It's high up in the sky and it points out the importance of victims' rights. Also, there are 2 community events next week. Tarrant County College next Thursday at 10 o'clock. Y'all are invited. I know a number of y'all are out of town and can't make it, but anybody is invited. It's South Campus, Tarrant County at 10 o'clock. And then on Friday at the Women's Center, there is an event in recognition of victims' rights and a tree dedication in remembrance of victims. Personally, I would like to thank the county, the commissioners, judge for the work y'all do, the support y'all have given our coalitions, the many people, some who are represented here today, that work in the agencies that work with victims and survivors. Things you show support every year through proclamations, but you also show support daily as you have appointed victim assistance officers with the district attorney's office and other county programs and specialized programs such as the Family Violence Court. On behalf of us, again, I would like to thank y'all.
Thank you.
Thank you.
Thank you.
Thank you.
Looks like a busy week.
It is something every day.
Again, thank you all very much for the collaboration. Commissioner Johnson, I believe you have a proclamation and a resolution.
Yes, I do, Your Honor. The first one is Donor Memory Garden. If you would read that into the record, please.
Okay? Whereas one of the most meaningful gifts that one human being can give to another is the precious gift of life, sight, and health, and whereas the needs for corneas and tissues surpasses the number donated each year, and whereas Lions Club International of District 2E2 and UT Southwestern Medical Center Transplant Services provide sight and tissue services in Tarrant and surrounding counties of North Texas. And whereas over the years, Lions Club International District 2E2 and UT Southwestern Medical Center Transplant Services have facilitated the contribution by hundreds of donors, which have resulted in thousands of patients receiving vision-related transplants. And whereas the above-named groups recognized and do hereby acknowledge the role of transplant medicine and donor families in the community medicine by the Memory Garden in the Fort Worth Botanical Gardens in the spring event on April 21st, 2012, now therefore be it resolved that we, the Commissioners Court of Tarrant County, do hereby recognize that these efforts and those of all donor families are a vital part in the circle of care for all our citizens by making transplantation possible. Further, that we hereby proclaim April 17th, 2012 as Garden of Life Spring Celebration Day throughout Tarrant County. In witness whereof, we have hereunto set our hands and caused the seal of Tarrant County to be affixed this 17th day of April, 2012.
I move for its approval.
Second.
We have a motion and a second. Please vote. Motion passes unanimously.
My good friend Clayton Meisner with the Lions Club is here to accept this proclamation.
Good morning. Good morning. Again. Yes, sir. All right. Any comments you'd like to make? All right. Any comments you'd like to make?
12 years we've been doing this, we appreciate every time we come and do this. I would let you know, in Tarrant County by itself, we have helped 167 people with sight, with corneal transplants. And this Saturday we'll have the garden situation at 10 o'clock in the morning. And that, so y'all are welcome to come. I appreciate it so very, very much with y'all. Thank you.
Thank you.
Thank you, Clay.
And my next one is Texas Agrilife Extension volunteers. Judge, if you would read that into the record.
Now I know why you were grinning a few minutes ago.
Why, what?
Well, we were we were asking about pronunciations, and I was kind of laughing at him about pronunciations, and then I read through the resolution and say, I'm going to get to pronounce it before he does.
If anybody can mess up names, the
I'm the
judge,
one.
myself, and Gib Lewis, if y'all know him, can all three mess them up the best.
Whereas volunteering one's time and resources is an essential part of the spirit, essence, and tradition of our country, and is increasingly recognized as a key partner of government, education, and industry in doing the work of our nation. And whereas it is ever more evident that our nation's greatest resource is its people, who possess many skills and talents which they generously and enthusiastically apply to a variety of community tasks. And whereas volunteers generously give of themselves and are an integral part in the delivery of research-based information. And whereas 4-H volunteers such as Lois Bagash, manager for the East Fort Worth 4-H Club, provide opportunities for youth to develop knowledge and skills in content areas as well as life skills such as responsibility, leadership, and service. And whereas embracing the child-centered philosophy, Ms. Bogash manages a large active club which provides multiple opportunities weekly for youth to engage in learning, leadership, and service to the community. And whereas the people of Tarrant County benefit from the deeds of these dedicated individuals, now therefore be it resolved that we, the Commissioners Court of Tarrant County, do hereby honor and thank the dedicated volunteers of Texas Agrilife Extension who give so freely of their valuable time, energy, and abilities to serve the people of Tarrant County. In witness whereof we've hereunto set our hands and caused the seal of Tarrant County to be affixed this 17th day of April, 2012.
I'll move for its approval.
Second. We have motions and seconds. Please vote. Motion passes unanimously.
And we have Cindy Bryant and CEA 4-H and Youth Development, and Lois Bogash, 4-H Club Manager. If you would meet me at the podium, please. I can't believe we don't have all those good-looking kids up here.
Yeah, where are the kids?
Good, you did good.
Yeah. What's her name?
I'm trying to get.
All right, any comments that y'all would like to make? Please feel free to do so.
It is a distinct honor to represent all of the volunteers of Tarrant County and before this distinguished group, and we appreciate this opportunity to share with you about some of the volunteering that goes on. Master gardeners, we have 366, 154 H volunteers, 116 program area committee members, 36 TEEA members, and 15 master wellness volunteers, providing 74,216 hours of community service in 2011. Also, the value of this volunteer time amounts to over $1.5 million. And there are, the volunteer staff is equivalent to 42 additional unpaid employees, we should say. And we want to thank Ms. Dana Tarter, who directs all of these. Dana, would you please stand? And with us we have Darlene Myatt, who's our nutritionist. And then do we have Master Gardeners here? Well, it's a large effort, and so we want to thank all of those people and who give back to the community. Our particular 4-H club is an example of what can be done in a community partnership where people have a collaborative effort. We are sponsored by Meadowbrook United Methodist Church, but also East Fort Worth Breakfast Optimist Club and many of the citizens. And they all get together in this collaborative effort to produce future leaders with civic responsibility who have a very keen interest in giving back to the community. And so we thank also J.D. Johnson for all of his support with 4-H. And so thank you for all of these opportunities. And hopefully we'll have, with all these active partners, we hope to have a positive produce a positive atmosphere for citizens in Tarrant County. Thank you.
Thank you very much. I would like to ask those students that came this morning, if y'all would please rise and let us recognize you for a moment. Everybody stand up.
Our president of our club is here, Miss Sky Segovia.
Would you like to make any comments at this time?
Come on up.
Come on up. Yeah, we want to hear this. Put it on the spot, huh?
Well, it's a pleasure to be here. I was here before accepting a proclamation for the 4-H. I couldn't have been anything that I am now without Miss Lois. So she's been a really huge mentor, and she's made a lot of effort in my future. So she's awesome.
You did very well. Thank you. Thank you very much.
You, Sky.
Thank you.
And I also want to take this opportunity to introduce State Representative Barbara Nash, who is here this morning and was a part of the appreciation of the volunteers back at 4-H earlier this morning. Representative, any comments you'd like to make at this time? Never pass up an opportunity to.
Representative, I'd like for you to recognize your son with the name you told me a little earlier.
I'll introduce Judge John Chupp. He's kind of hiding back there.
Stand up, Judge. He's one of our fine judges.
Well, I'll just say that
Yes, you did.
if I said that, I'm sorry. I just want to tell these young people that they are our future. We say that over and over, but as a mother of a judge, I'll tell you, we set the role. You all set role models for them to follow, and you couldn't follow better role models than we have up here. Thank you.
Thank you, Steve.
Thank you.
I want to thank Representative Nash for coming down. She's a brand new resident of Precinct 1.
We also just received a very bad news that Commissioner Marty Van Ravensway's mother, Mrs. Mary Kemp, just passed away this morning at 9:18 a.m. If we can we close in her memory, please?
Certainly.
Absolutely. Thank you.
Thank you, Commissioner. Court members, you have before you the consent agenda.
Move approval.
Second.
We have a motion and a second to approve the consent agenda. Any discussion? Please vote. Motion passes unanimously. Mr. Manius.
Members of the Court, we have 3 items to bring to the Court this morning. The first one, we're requesting that the Commissioners' Court approve a contract between Tarrant County and PTP Transportation in an amount not to exceed $48,800.
Move for approval.
Second. We have a motion and a second. Any discussion? Please vote. Motion passes unanimously.
Members of the Court, on item number 2, we're requesting that the Commissioners' Court consider and approve an exception to the county's travel policy as it relates to the Justice of the Peace Precinct 1 office.
Move approval.
Second.
We have a motion, a second. Any discussion? Please vote. Motion passes unanimously.
Finally, members of the court, on item number 4, we're requesting that the Commissioners Court receive and file a report from the Texas Commission on Jail Standards as it relates to the inspection of the Tarrant County jail system.
And how many years in a row is this?
This will be 18 years in a row for where we've passed jail inspection, and just somewhat of a historical note, there are 29 years in a row for jails that have been supervised by Chief Bob Knowles.
My congratulations. Congratulations to all the Sheriff's Department employees and to you, Sheriff.
Move approval to receive and file.
Second.
Sheriff, I'll be, let you come up and make a few comments. I also want to thank Facilities, Clarence, and your department. We have an opportunity to do the exit interview with these folks last week, and I will tell you they had nothing but compliments about the sheriff, his department, Chief Knowles, really from top to bottom. All of the folks in Facilities, they have said for years now that if they find something going through on the inspection, it's usually fixed by the time they come back. There's such an attentiveness to really keeping the facility nice and up to grade, and not just up to speed. I mean, they're well above that. And the sheriff makes comments, and I really believe that it's true. Is that where a lot of places know when the jail inspectors are coming in and can get prepared for it, I think Tarrant County is prepared for it 24/7, 365 days a year. Sheriff, any comments you'd like to make?
Thank you for the kind words. We were especially honored this year. Mr. Munoz, who is the executive director for the Jail Commission in Austin, made a special trip to fly up. As some of you know, he's retiring in September. And before he retired, he said he wanted to come and honor what he considered one of the best jails in the state of Texas. So we were extremely honored by that. Chief Knowles and I get a lot of credit for the jail inspection, but I brought some people today who are the core of the workforce over there, who actually day in, day out are in there working, making sure the jail stays well above minimum standards. If you guys would stand up. Come on, don't be bashful. Stand up. These guys, as I say, are the workforce behind everything, the captains and the lieutenants that actually make up the core of our group and our organization. And, we are tremendously blessed. I can't miss the moment to Mr. Phillips. Thank you. I used to say in a joking manner that I think jail inspection was as important to Clarence as it is to me, but I don't think that's a joke any longer. Honestly, I think Clarence takes it as to heart as I do, and he told me one time that if Facilities caused us to fail jail inspection, it would be the absolute worst day of his life, and I truly believe that. And the steps they go to, it's just unbelievable what they do to help us and to assist us. And, Judge, during employee recognition, you always say, it's the people, it's the family, and let me tell you, Chief Knowles and I are blessed to have the group of people that we have working for us. It is truly people that take such pride in the operation of that facility, but most important to me and most important, I think, to them is that they take care of each other, and they care so much about each other, and they all want everyone in our organization to succeed. So I appreciate the kind words. It was a great moment for Tarrant County to have Mr. Munoz come up and award us with some awards from Austin, and we're very proud to stand here again, and we plan to stand here every year from now on that I'm here. So thank you.
Thank you, Dave.
And let me also say, it's real easy for this, just to kind of become it's a routine type deal, and of course we're going to pass. But everybody needs to understand, for the longest time, we were the only large urban county jail that had passed jail inspection. And most of them can't claim to have done it 1 year in a row, or 2 years in a row, let alone 18 years in a row from that standpoint. It's not something that just happens. And one of the other things that we comment about, even the prisoners, I think, are concerned and take this seriously. And you kind of think about that and you laugh, but I think it really goes back again to a lot of the employees that we have over in the jail. Time and again, when I talk with these folks on a monthly basis, what I hear from them is they try to treat the people that they're dealing with on a day-to-day basis with respect, and to not treat them as though, okay, you're in here for something and you're not worth anything, and just, treat them poorly. And I think as a result of that, the prisoners have a different attitude. And so I think we're very fortunate, one, to have the people that we have working for us, the people who take it seriously and who take their service seriously and treat every individual, regardless of where they may be in their lives at that time, with respect. And for that, I'm very thankful. And again, please pass that along to the folks who are working the floors, who are working that. Clarence, David, the folks in facilities who make this happen, and really everybody who works toward making sure that the facility is a nice facility and that it is kept up and meets those standards. Please vote. Motion passes unanimously. Again, thank you all very much.
Thank you.
Ms. Snyder.
We tried to add a little excitement to jail standards. While they were here, we actually had a car who was going down the wrong way on Weatherford, ended up at the corner of that building, lightly tapped it.
Trying to break in.
Yeah, who would have figured that one? And, in my early days, the maintenance of the facilities were actually done by the Sheriff's Department. And it wasn't a pleasant transition, but obviously it's one that, in the long run, has really benefited all of us, I think. Risk management. We are recommending, the Risk Management Board is recommending the payment of 2 claims, all related to one case, and it's partial as far as what we'll expect from this one to come overall. It's only the property damage on a trailer and a resulting wrecker service bill.
Move approval.
Second.
We have a motion and a second. Any discussion? Please vote. Motion passes unanimously. Thank you. Mr. Wright.
Thank you, Your Honor. We have 2 subrogation checks requesting authorization for the county auditor to accept these in the county treasury. First in the amount of $321.48, and the second in the amount of $1,158.33.
Move approval.
Second.
We have a motion and a second. Any discussion? Please vote. Motion passes unanimously. Thank you. Ms. Glenn?
Move to receive and file personnel agenda.
Second.
We have a motion and a second to receive and file a personnel agenda. Please vote. Motion passes unanimously.
Thank you. We have 4 additional items. Second item, we're asking the court to approve an out-of-class pay extension for juvenile services. This is a request that you've seen several times previously. If you recall, this involves the responsibilities that that an employee actually has assumed from a caseworker supervisor who's assigned to the JCMS project. Juvenile Services is requesting an additional extension that will take us through the middle part of July. The cost is estimated to be approximately $2,100, and these are grant funds, not county funds.
Move approval.
Second.
We have a motion and a second. Any discussion? Please vote. Motion passes unanimously.
If we could just skip over item 3, we'll come back to it. Item number 4, we're asking the court to approve a subsidized work experience program agreement with Workforce Solutions of Tarrant County. This is an agreement that you've seen before. We've actually been a partner since 2009 with the Workforce Commission. Initially started out as a summer program for youth. Currently, it is a year-round program, and so we're asking the court to approve the agreement this time around so that we can begin to try to place some of the youth that are approved through the program.
Move for approval.
Second.
We have a motion and a second. Any discussion? Please vote. Motion passes unanimously.
Our fifth item, we're asking the court to approve a waiver of terminal benefits and a request to double fill for Precinct 3. The Commissioner's Administrative Precinct Administrator is going to retire at the end of this month with 400 vacation hours. The Commissioner is requesting a waiver of the 400 vacation hours. It's also requesting, again, a request to double fill the position for approximately 1 week. Your court communique indicates a fiscal impact of almost $12,000. I believe, though, that most of that will be offset by salary savings. We do have an applicant that the Commissioner has extended a job offer to. I've not seen the actual numbers, but I know that we're going to have some reduction of this fiscal impact.
Move approval.
Second.
We have a motion and a second. Any discussion? Please vote. Motion passes unanimously.
If we could go back to item 3, Ms. Hancock and Ms. Worthy have a brief presentation for the court. I believe Ms. Hancock is going to begin.
Good morning.
Good morning.
Good morning.
Okay, we are going to give you a little report on the wellness program, kind of update the things that have happened the last year. So this is an aggregate report of the health risk assessments, and we're comparing 2010 to 2011. So there are only 725 employees that participated both years that we're looking at here. And we had improvement in 4 of 5 areas of the lab work that was done. So we had on HDL, LDL, total to HDL ratio, 9% of those 725 employees made improvements in those areas, and 1% made improvements in glucose. So we're continuing to show improvements every year with the program that we're doing. And then just a little recap on the incentives that we did. The $50 incentive for doing the health risk assessment, we had 1,129 employees participate in the health risk assessment last year. So that was $56,200. And rewards received, we had 369 employees that actually received rewards, and that was at $82,440, and there's a breakdown in the level of the reward that they received there. We had the 3 different levels. So now this chart here is showing you a per capita percentage of the people that participated in the health risk assessment. So like the first one, fire marshal, of course they have a total of 4 employees, and all 4 of them did the health risk assessment, so they got 100%. So you can kind of look at participation, which departments are participating the most in the health risk assessment. I'm glad to see that HR is in the top 10. That's always a good thing. And then the next shows the per capita of the rewards received. So again, fire marshal, I guess they have an advantage there for 100% participating. They're number 1 on receiving rewards as well. At 50% of that department received rewards. And again, I mean, I'm really pleased. I like to use Precinct 3 as an example. They're up there in the top 10 on the rewards, and they participate really well. And one of the reasons for that is they have that middle supervision. They have all their supervisors. They have Marianne Reike and Beverly Gazelle and people out there that are really pushing it and helping, like the maintenance guys, participate and reminding them. They put little notes in there when they clock in their mailbox, you know, it's time to do this, it's time to do that. So I think that has a lot to do with their success, is that middle supervision. That's what we really need. And now we're going to look at some changes that we want to make to the program for next year.
Leadership, leadership.
Ms. Worthy is going to...
I think you're stimulating some competition among us now.
Absolutely. We want to, that was the reason we actually decided to show some of those statistics on departmental representation and participation is we would really like some of the departments to maybe get some friendly competition going, maybe with the commissioners or some of the departments downtown, having some competition in or what have you, in participation. So as Kay mentioned, we do want to propose some changes to our plan today to you. As we move forward in our goal to assist our employees in better health, we want to update our program. I want to just give you some statistics that I have found recently based on a survey that nearly 28% of adults in America are considered overweight. 9% have diabetes. More than 17% smoke. The U.S. spends over $147 billion in direct health care costs that are associated with poor diet and inactivity. And these are things within our control and things that we can do to improve our health. And not only do we improve our health, but from an employer's perspective, a healthy employee is less likely to have high absenteeism and issues with, or even presenteeism, where an employee comes to work sick and aren't really quite as engaged as they should be. So let me cover the changes to the program. On the left-hand side, you'll see the current program, and on the right-hand side is the proposed program. We currently have what we call a participation program, and a participation program is just what it says. In order to get the rewards and the points, you just have to participate. What we want to move towards is a standards program, whereby employees will have to meet some minimum standards in order to get those points and get those rewards. So, for example, in our STEPS program, the program where they wear the pedometers, right now the goal is 10,000 steps a day. And so if you had an employee that logged 1,000 steps a day and turned that in, they would have participated and they would have gotten points for that particular activity. As we move forward, we're going to set minimum standards that have to be met at the end of the 12-week period of each activity. We will continue to have 3 physical activities required, but there will be standards associated with those, and a minimum of 2 education classes that must be met in order to get points. One of the things that we hope to roll out this next year is some online classes, which we hope will help those folks in the satellite areas to be able to participate in more education. And currently we have 3 levels of rewards, and we would like to go to 5 levels. We currently also allow employees to get their rewards to their flexible spending account. What we would like to propose is that we let the employees have 2 options. They can continue to get it to their flexible spending account, or they could have it awarded as cash via payroll, and of course it will be subject to their applicable taxes. Okay? We've developed what we call gold standards, and in order to get the highest level of awards, an employee must meet 2 or more of these gold standards. So the gold standards are a BMI of 30 or less. 25 is at the high range of considered healthy. Over 30 is considered unhealthy. So we're giving a little bit of flexibility there. However, if we have somebody that's above 30 and can't really reach that, we're going to allow them to meet that standard by losing 10% of their weight, which is proven to be statistically improves their health. We want our employees to be non-tobacco users, and we would like our employees to have annual physicals so that they have a relationship with a physician and hopefully can ward off any kinds of illnesses. Our levels of rewards, we currently have a bronze level that is 5 to 7 points that allows an employee to get $120. That will continue. It'll be called a level 1. We'll have a silver award, which is 8 to 9 points. We're going to change that to be 8 to 10 points. Again, it'll be $180. Then at level 3 and above is where those gold standards come into play. If I have an employee that meets those 3 gold standards but don't participate in the activities or the education, they would be eligible for $200. And then level 4, if they meet 2 of the standards and work the program at a high level, they would be eligible for $250. And then the level 5, they've met all 3 of the gold standards. Again, working the program at a high level would be eligible for $300. So today what we would like to propose is to ask for your approval of the changes to the program, in addition to continuing the $50 incentive for participation in the health risk assessment. As you know, we do the health risk assessments annually, and they're required to participate in the awards program. So you have to have participate in the pre-HRA and the post, and we would like to continue with that incentive and be glad to answer any questions that you have.
Move approval.
Second.
We have a motion and a second. Any discussion? Please vote. Motion passes unanimously. Thank you. Mr. Beecham.
We have 3 items for your consideration this morning. Our first item is a bid award recommendation for RFP 2012-040. This is an RFP for a digital x-ray system for the ME's office. A recommendation will be toward the Southwest X-ray Company, the amount of $177,956.
Move approval.
Second. We have a motion and a second. Any discussion? Please vote. Motion passes unanimously.
Number 2 item is a bid award recommendation for RFP number 2012-042. This is an RFP for health information portability and accountability security compliance consulting services for the health department. Recommendation will be toward the KPMG, the amount of $147,000.
Move for approval.
Second.
We have a motion and a second. Any discussion? Did we, go ahead, Roy.
This contract will make sure that we have all of the systems and safeguards in place to meet HIPAA regulations.
Yes, sir. Dr. Dixon is here if there are questions I can't answer also.
Did we do any checking with JPS by chance to see what they might have going on in that same regard, or did we coordinate with them?
We actually are going to address the HIPAA security safeguards, and so we want to make sure that we're in compliance with not only the HIPAA security, but also some of the new regulations that have gone into effect. We did have a RFP in 2006 that kind of laid a roadmap, but a number of things have happened since 2006. We now have HIPAA breach regulations. We now have the new healthcare reform that changes some of the HIPAA regulations. So we want to make sure, and we want to have them come back in and reassess now that we're moving into the era of electronic medical records to make sure that we are compliant with HIPAA security. We do have the HIPAA security officer for JPS does participate with us in our HIPAA security meetings. So they are aware. We do have a dialogue with them. Did that answer your question?
Well, I guess, I mean, you know, we've put the Public Health Department under JPS's budget. And, you know, I think we really need to coordinate things when we're doing things that have to do with public health. I really believe we ought to be coordinating this to some extent with JPS. And so my question is, are we doing that?
This here is an assessment of our rules and regulations for HIPAA. We also have JPS.
Public health. For public health, though. That's why I mean.
Yes. And we have JPS HIPAA security people that meet with us regularly on this. It's an evaluation of our system, not of the system as a whole.
But our system is technically under JPS's system because public health is under JPS's control and budget.
It's not under JPS's system. Public health is under the.
Who's their budget under?
What's that?
Their budget is under JPS.
We receive part of our funding from JPS. We receive a much greater, a much more substantial amount of our budget through other contracts that we have.
But those are contracts, as far as the county's money that goes into, the county itself does not put money out of our general revenue, does it, into public health?
No, it does not.
It's all under JPS. And I guess, again, my point on this thing, and I've said this time and again with the budget, as a court, we have said because of tobacco and because of other things that we get reimbursement for, that it was better for public health to be under JPS.
The funding element, yes.
Well, kind of the way I've always looked at it is if you're going to have the funding of it, then you ought to have at least some initial role in being responsible for it.
That's not necessarily a position that the Commissioner's Court has taken in the past.
Well, I don't know that, maybe so. But I guess what I've always taken the position that if we're going to give it to JPS, that JPS at least ought to have some ability to talk about this and to be a part of it. So I just ask the question is when we do things like this, we're fixing to spend about $150,000. My question would have been, did we try to do anything in conjunction with JPS to see if we could have gotten it all done under one review, as opposed to us going out here and doing an independent review, when again, now I assume that, who's paying for the $147,000?
We're using our Medicaid revenues to help us with that.
Grant.
And this is money that our services, our clinics generate by seeing clients. And you can only spend it in the areas that you generate the funding, and you have to get approval from the state to be able to do that. So it's very specific areas that we can use the funding. And then, as Dr. Dixon mentioned earlier, we have had consultation from the JPS HIPAA people. They have sat in on the meetings with us.
So my question question ultimately would be, is if we weren't spending the $147,000 here, we would still be able to spend it on other services. So the question is, did we make any attempt to coordinate a HIPAA review with JPS to see if potentially we could have saved $147,000 or not spent that much in going through that process?
Well, I don't know that we specifically asked that question, but we had them at the table, so there was certainly the opportunity for that to come up in the discussion. I don't know that it actually did, but what I was going to say is there are some things that we have in common, and there's some things that we don't. So I think if we even found some common areas, there'd still be areas that we needed to look into because of the difference with public health and hospital.
And I guess my main reason for going here is that my appointments to the hospital board continuously, especially around budget time, come to me and say, you know, you make us take this budget, but then you don't let us have any participation in what's going on or in the dollars that are being spent. And so, you know, I understand what they're saying, and I agree with what they're saying. You know, part of me says if we're going to put public health over under JPS, then at least at a minimum, we should allow them some degree of ability to go in and to work with public health. And it sounds like they're already doing it. They're sitting in on a lot of that. But I think we've pretty well said in the past, hands off when it comes to really managing that budget. And that's something I don't agree with. So this is $147,000. Maybe that's the least we could have done. I just don't feel like that we've actually made an attempt, or I'm not sure, and that's what I was asking. Have we made an attempt to see, had we gone to JPS and said, you know, who did y'all use? Could we have gotten it done for less than that? When did you have it done? I don't know that there was any attempt, and I think JPS has pretty well been told, don't mess with us. And so they don't look for opportunities to possibly save money in that regard.
What percentage of your budget is funded directly from JPS budget?
It's our budget changes from almost day to day, but it's approximately a third. And the other 2/3 are from state and federal funding. But then you've got some Medicaid revenues, you've got some fee for service. So that's a ballpark figure.
From a managerial standpoint, who are you accountable for? Are you reporting directly to
I'm accountable.
the GK administrator?
I've always been accountable to GK and to you as a Commissioner's Court.
Not the JPS board?
No.
Oh, okay. I can see where the judge is coming from. On the one hand, we have certain funding come from the JPS, and then from an accountability standpoint, you're reporting directly to basically to us.
Operating a public health department and operating a hospital are two distinctly different disciplines. We're sitting up here talking about maybe JPS ought to have more managerial control over the public health department. Number one, that's not the way it was set up to be. That's not the way we've done it. And we've never asked JPS whether they even want to be bothered fooling with. Wait, I ain't done yet. I am not done yet. And we haven't looked at the cost benefit of us doing it as opposed to JPS doing it. I would suspect that since we're doing it with existing resources, if we were to change that managerial control to JPS, it would cost more money.
Well, I'm going to go ahead.
I don't think the judge is recommending that we change the management of this arrangement to JPS. He only asked.
I've heard that mentioned.
Hold it, I'm not through yet. I believe is what you said.
I said, I ain't done yet.
I ain't done yet either. So I think he's only asking, did you check with JPS to see if they had gone through this process and perhaps saved some dollars from this amount, not for them to manage this program.
And
did I miss something?
Well,
I think you missed something.
What did I miss, Mr. Brooks?
Well, y'all can both interpret what I'm saying if y'all would like to, or I can go ahead. I mean, I do believe you're right. I'm not saying that it should be totally under the management of JPS, but I disagree with you vehemently on the fact that they're two entirely distinctive goals. Or it's health. It has to do with the health of the individuals. And I believe that JPS and the folks involved out there are as concerned about the public's health as they are about meeting the needs of the folks who come to their facilities to serve.
Well,
Can I finish? I ain't done. And I guess what I'm saying is I constantly hear the fact that you make us take the budget. We as a general fund don't put a dollar into public health. And as a result of that, we've moved that over to John Peter Smith. And I constantly hear, you put this whatever millions of dollars onto our budget, and you don't give us the ability to even look at the way it's run or look at the way that we might be able to work collaboratively together and save money. And when we've, in the past, when some have said that we inquired, we were told that was not our business to stay out of it. And I've never thought that was right. And I have said from the day one when we moved it over there that because of their experience and because of their knowledge of health care, that they might have something to offer. Granted, as a commissioner's court, I think ultimately if there would be a disagreement between what JPS thought public health or what ways they might be able to help and what public health felt like they needed, that they could come to the court, and then at that point in time, we would intercede. But I think what we've done, and at least the way we've represented it, is that here's the money, you pay the money, but don't think you've got anything to do with it. And I've always disagreed with that, and quite honestly, this is just an example that comes up of we spent $150,000. My guess is that there was no discussion with JPS prior to the issuance of this RFP or it coming back that says, what have y'all done, and could we do it through y'all at a cheaper amount? And we're fixing to start budget process again right now, and we're gonna get a budget from public health, and without any consultation probably from JPS, we're going to say, here's your new amount. At some point in time, our board appointments over there may stand up and say, why? Why don't you give us an opportunity to manage the $7 or $8 million that you ask us to fund out of this deal every year? I'm done.
You done? You sure? Okay.
Well,
you want to interject or before?
I want to interject, if I may.
Yes, sir.
And my interjection has to do with your vehement objection to the fact that they are two different disciplines. All of the national data and all of the national studies recognize the fact that public health and tertiary care are two distinct disciplines. One is concerned with prevention and education in the community. The other is concerned with sick people who present themselves at the door of the hospital for care. Two completely and distinctly different things.
Well, the only thing I would say is that this whole new health care act, which I think the president has tried to push down, is basically all designed around us doing...
You mean the one that the Congress passed?
Yes, parts of them. And is all designed around preventative and moving the whole health care industry to a preventative basis, which I think is what you just said that public health was only doing. And what I'm saying, and what the 1115 waiver that Mr. Early was so essential in getting does, is to try to move the public hospitals to that preventative care. And I feel like they're very well prepared to do that, and I believe we should be collaborating both of the systems together, and I don't think we're doing that right now.
Collaboration, yes. Moving in that direction, yes. Have we gotten there? No. Have we reached the deadlines by which we're supposed to get there? No. Is it happening now? No.
Because we've told them we don't want them to do it. So we've been the roadblock to the collaboration thus far. Commissioner Wynn?
We are, tell me what the purpose of this contract specifically.
Dr. Dixon just reminded me that a large part of this, not all of it, but a large part of this risk assessment is going to be looking at all of our electronic information, which we have quite a bit, and that involves the Tarrant County IT group, who has been involved in these discussions as well. So we really are looking at, what do we have within our electronic domain, and how do we need to be protecting
So a large
that?
part, the scope of work of this contract is to look into your network, your IT network, as relate to security compliance with the HIPAA demands, right?
Right. For public health information.
For public health information.
Right.
Let me ask you this. Is that network linked to Tarrant County network, or is it linked to JPS network?
Tarrant County.
Tarrant County network. Okay. So essentially, in my opinion, I think we are dealing with two distinct issues. Number one is what you are talking about. I think it's a very valid concern that we need to move forward in exploring the different options to see if the current arrangement is the best or not. The second issue is approving this contract. And this contract has to do with getting public health to be in compliance with federal law as the way it is right now. So that is my opinion. I don't know if it's opened up any other ideas or not.
Well, I think we're going to go forward with spending this money. But I guess so you're basically your public information or your information right now, your IT information, in no way is communicated or is available to any of the other hospitals in the county or to JPS or anything
No,
like that.
that's not correct.
So it is connected with JPS to some extent.
It is available. Actually, we get information from them, and they get information from us. And that will be even more possible after everybody gets their electronic medical record systems up, and we get going with our regional health information exchange, for which we have a piece. And we've been in good conversation with JPS about the whole health information exchange and electronic part, but everybody's kind of building their side of the bridge to meet in the middle, and that's not quite there yet, as Commissioner Brooks said, but it's getting there. It will be there. But we exchange information now about immunizations, about communicable diseases.
And so I guess, Andy, my point was to that end is that they're already exchanging information.
Right.
And so if the IT has been done on one side, could it not have been done collectively at the same time when JPS's folks were looking at their electronic medical records and their HIPAA? I don't know that they looked at other entities that they might be bringing information into or providing information to, but we're not coordinating. And I believe the reason we're not coordinating is because we've pretty well told JPS in the past, hands off.
We did have a discussion with the previous JPS staff, both with IT and administration. That was a different group of people, and we did approach them about doing that very thing. There was no follow-up.
Well, as you said, that was a different administration.
And I sat in on some meetings with public health and JPS about creating systems that at least talk to each other, IT systems that at least talk to each other, and those were very high-level meetings. So that has and is occurring.
Yes.
But sharing information is different from ceding management control.
And what this request is about is protecting private information of the individual so that none of us accidentally release information that would harm the privacy of the individual.
I think it is pretty clear that the court wants to move forward with approving this contract, I think. And then also the court wants a certain effort in exploring the current situation and different alternatives to see if we can structure the management or maybe collaboration or coordination to have more effective results in terms of sharing resources, financial, IT, and so forth. I think that's what the court is communicating right now.
Do we have a motion and a second right now?
Yeah, I'll call the question.
Please vote. Motion passes unanimously. And I do agree with Commissioner Wynn. You know, at least right now, my leaning would be that your budget goes at least preliminarily to the hospital managers, board of managers, and that it then comes to GK or to the administration and then through to us. And if there are disagreements, then certainly that's where you would come to us and talk about that. But I believe that through a collaboration, how many clinics do you have?
In terms of locations, we have 20. In terms of various services, there are many more than that.
Okay. I just think that there's some things that we could be doing collaboratively.
And
Thank you, Lou.
if I might
Oh, no,
just-
you've got another item, I'm sorry.
Just might say that, you know,
you've got
it's time, we can revisit this. But I will tell you that there were different members on this court. But at one time, we did have these discussions with the court, and that's how it was structured. But we'll go back now and we
I don't
hear
know
what
that
the
we ever
court said.
took a vote on that. I mean, again, I would say I have always felt like if we were going to give them the budget and we were going to say you're going to spend those dollars, that you should have more control over at least seeing the budget before it comes to us.
And you know, we also gave them 1 cent on the tax rate increase to fund these things. So, I mean, but we've heard what the court has said, and we'll make sure that happens.
Item 3.
I'd like to be done.
Go ahead.
I apologize. That was inappropriate. We have one last item for the court's consideration. So, bid award recommendation for bid number 2012-071, signing a contract for automotive and light truck parts and supplies. Our recommendation is to award a per discount from list price, selecting as our primary and secondary vendors, as shown in your court communique.
Move approval.
Second.
We have a motion and a second. Any discussion? Please vote. Motion passes unanimously.
I apologize.
Thank you. Commissioner Wynn, I believe you have an interlocal agreement.
It's a move for approval of the interlocal agreement on item M1, A, and B.
Second.
We have a motion and a second. Any discussion? Please vote. Motion passes unanimously. Commissioner Fickus?
Yes, I have an interlocal agreement with the City of Southlake. Move for approval of item M2, A, and B.
Second.
Have a motion and a second. Any discussion? Please vote. Motion passes unanimously. Commissioner Johnson?
I have two interlocals, one with the city of Hazel, one with the city of Sampson Park, item 9M3, A, B, C, and D. I'd move approval.
Second. We have a motion and a second. Any discussion? Please vote. Motion passes unanimously. Are there any appointments? Being none, then you have before you the claims, including the addendum.
Move for the approval of the claim register and the addendum.
Second. We have a motion and a second. Any discussion? Please vote. Motion passes unanimously. Mr. Early, I've warmed them up for you. Come on up.
Tell us what you really think about that issue.
Welcome, Mr. Early.
Can't tell you how much I look forward to being with y'all today. It is somewhat surreal to look at the five of y'all and then everybody in the audience is turning around looking at me. So it's kind of an interesting place to be.
Well, at least it's a good thing that you got here early enough today that you caught the...
Yeah, I'm delighted to do that. But a couple things, and I will address that as well. The one thing I did want to say is I want to commend the sheriff and the sheriff's department on their jail standards and where the approval of that commission that came in and reviewed them. I will tell you from a hospital setting where we constantly get reviewed, when you pass one with flying colors, they come back and review you harder and more difficult. So I think for you as county commissioners and you as judge to have the sheriff's department and the team that you've got and that's been assembled in the sheriff's department is quite a compliment to this county. And we are trying very hard to be at that same standard at JPS. We have inspectors that come in for every reason all the time, and we want to pass those inspections. We just recently had an inspection crew come in. Every 3 years we're inspected for our level 1 trauma, and we were just inspected for our level 1 trauma this time. I will caution to say that it's a preliminary report, but we had absolutely no deficiencies and a lot of compliments for the level 1 trauma center that we were running. That's our first, and we're proud of it. Thank you. Thank you. I'm proud of the team. You got an incredible team over there. Dr. Gandhi and his group running a great ship. I think one of the things that was a little ironic is the team came in 2 weeks ago on Monday night. Tuesday morning the tornadoes hit, and we were moving patients out of rooms, putting visitors in hallways without windows. And one of the inspectors came up to me and said, if you can do this during tornadoes, you're pretty much approved. So we didn't schedule the tornadoes, but serendipitously they did work in our benefit. Wanted to give you a quick staffing update because I think it will make significant differences to JPS. We brought in a new Vice President of Human Resources. We did that because we took our current Vice President of Human Resources and moved her to become our Chief Diversity Officer. And Dresden Flynn White will do that role. We also now brought in Nikki Sumter. She came to us from the North Carolina health system, and so far she has been fantastic. I think you'll see big changes. You can't culturally change the organization at JPS unless you do it from top throughout the organization. And you can't do it without bringing in the best people with a new agenda for treating your patients and dealing with quality and safety standards. And I think Nikki will do that. I'm very impressed with her thus far. I think she'll be a great addition to us. We had Commissioner Tom Cease in, our Health and Human Services Commissioner. He spoke to the board, complimented this county for the efforts that we've taken to try to be a leader with the 1115 waiver. We also gave the commissioner an award for his service to the state. I think he's done a lot. And I think he's constantly in the line of criticism, and nobody's complimenting him for what he's done because his projects bring in public comment, so he doesn't have time to take a break and get compliments. And we wanted to do that for him. So we did that. I want to personally thank at this meeting Commissioner Brooks, because Commissioner Brooks was the one that provided JPS with a great idea, and that was to at least approach the Fort Worth South TIF and talk to them about their interest in potentially providing some funding levels for the abatement and demolition of the St. Joe's building. Also want to compliment Commissioner Brooks because he defended JPS, and I appreciate that very much. I appreciate individuals, both elected and public, who stand up and defend JPS. And sometimes historically that hasn't happened, and I got to tell you how proud we are at JPS for having that done. And the reason that we got $2.5 million of funding to help that project and bring down that historic building and put it in its rightful place instead of just a decaying building is because of that effort. So greatly appreciative. That's a very nice thing for us. The other thing, we've got great doctors doing great things. Dr. Seeley Massengill had two situations take place for him last week. Dr. Massengill was named the Tarrant County Medical Society president, which is a great honor for us at JPS and him. And he was also named our interim chair of our OBGYN department. Dr. Grimes, who is a wonderful man and did a great job of that, has unfortunately had to take a medical leave. And we're all sad by that departure and his medical leave, but pleased that Dr. Massengill will step up to that plate. I didn't realize when I applied for the job that part of my qualifications would be to define the quality of food at McDonald's and what level of health it will be. But I will tell you that the McDonald's contract is coming up. That is an issue that I found very few people that are lukewarm to. They either think McDonald's is a wonderful place and provides the food items that need to be presented at a cost that needs to be provided, or they have utter disdain towards the McDonald's Corporation in general. So I doubt that there'll be 50% of those people will be mad at whatever decision we make. But I will tell you that the decision that we have done thus far is that the status quo for McDonald's can't continue to exist. It is located in a healthcare organization, and you can't just serve what has traditionally been served. And to no discredit to McDonald's, but we have to wake up to the new world in which we all live in. Your wellness program is a prime example. You weren't talking about wellness programs 20 years ago. And various people in the community were, doing ads for things that aren't healthy right now. And a lot of us have changed our lifestyles very much. And so in that regard, I think we have to address McDonald's as well. And I've asked McDonald's to look at their menu to see if they have options. I have to also realize that McDonald's is pretty much open 24/7. It does provide food at a cost that is beneficial to many of our patients, beneficial to their guests and our employees. So this proverbial attitude of just kick them out the door is probably not the right attitude, but looking through it methodically is to figure out what they can and cannot do. The other thing that I do want, and I have communicated to McDonald's, that they will probably need to have some level of competition. I've talked to other individuals, and I've talked to people in the community as well. Commissioner Brooks has introduced me to some other individuals that I think might be of benefit in creating a marketplace where our employees, their guests, and our patients have more than just one choice. And I've already communicated that to McDonald's Corporation. So I am making headway and progress. It's not just a story for the Fort Worth Star-Telegram. It's actually fairly serious. And our kitchen has a real hard time staying open 24/7. We're not in that fast food type chain, so we're not equipped necessarily to do that. So outside. However, I will compliment the Fort Worth Star-Telegram. They're obviously being read because every franchise owner of fast food has now contacted me. And everybody has told me how their food is healthier than McDonald's at this point. Not sure
fries is good.
I don't know that their fries are as good. And as I was told yesterday by a nice lady that emailed me, she said, I want to remind you McDonald's does serve apple slices now. And I am aware of that fact. But it's an interesting place to be. In the discussion that you all had earlier, it would be remiss of me not to discuss that. I will tell you that any and all discussions with Mr. Manius, with the Public Health Department, with JPS, with our board, we'll be happy to have. We have a new interest from our board members that you as commissioners who appoint them obviously are going to get insight from, and you're going to hear from those. And any way that we can to make the dollars that we spend from our tax dollars be the most efficient and provide the best health care that we can in whatever element that it's in, we always want to do that. And part of that is somebody else does it, or in some cases we share it, or in some cases we do it. I think we need to look at the efficiency of that. And that's always the model that JPS wants to be in as we all deal with the public dollar and making sure that we have the right stewardship for it. And we'll do that at any time. And I think that discussion probably would be best served if we, certainly your discussion certainly promoted it, but I think we can have as many meetings as we see fit to make sure that it's profitable for all individuals involved in that issue. Be happy to do it. So I have no further comments other than to thank you all very much for allowing me to come, as you always do. If you have any questions, I'll be happy to entertain them.
Any questions? Thank you, sir.
Thank you all very much.
That's all we have at this time.
This time, we'll recess our open session and move to closed session to discuss items exempted under 551.071, 072, 074, 076, and 087 of the Texas Government Code.
Move approval.
Second.
We have a motion and a second. Any discussion? Please vote. Motion passes unanimously. And we're adjourning today in memory of Marty's mom.
I didn't find out.
She's been sick for a long time.
Yeah. She just passed away this morning.